It was mayhem on the streets of Los Angeles as demonstrators against immigration raids continued for the third day.
You've seen it in the headlines. LA is in chaos right now. Protests on the streets and all over your feed. People stumbling through clouds of tear gas. But do you actually know what to do if you're exposed to tear gas? Well, here's a hint. Pouring milk in your eyes like this?
Chaos during the protests. This is new video showing restaurant workers helping sheriff's deputies in Compton. You can see some of the deputies sitting in the booths as workers help to flush their eyes.
That ain't it. Hey, I'm Dr. Yomi Adeyemi, board certified urgent care doc, and I've been watching all of this chaos unfold along with everyone else. I'm not here to wade into the politics, but one thing I do want to speak on is the absolutely atrocious medical care I've seen rendered to people exposed to tear gas. So, how about we bust some myths and give you some real medical facts? Because if you or someone you care about gets caught in the crossfire, you could probably use some real answers, not just TikTok rumors. Hey guys, really quick before we jump into the video, I just want to say that, believe it or not, more than 90% of you guys watching this video right now aren't subscribed. I want to continue bringing you guys high quality content here on the channel. And to do that, we need your support. I'm not sponsored by any big industry names, and everything we do here on this channel is supported by you guys. So if you subscribe now, my commitment to you is that me and my team will continue doing everything in our power to bring you guys the highest quality content. Thanks for listening. Let's get into it. Firstly, tear gas isn't even a gas. It's actually a chemical powder. The most common ones are CS gas and pepper spray, what the pros call OC, for oleoresin capsicum. Law enforcement uses them to disperse crowds, but when these powders hit the air, they become a fine mist that's very difficult to escape. They attack your mucous membranes, your eyes, nose, throat, lungs. Within seconds, you're coughing, choking, tearing up, and blinded by pain. But is it deadly? And what actually happens? Let's talk about it. See, when tear gas hits, here's what happens. Your eyes burn like crazy. You start tearing up, can barely see. Your nose and throat on fire. You'll cough, you'll gag, and for people with asthma or lung issues, it can actually send you to the ER. Even if you're healthy, it can be overwhelming. Your skin can sting, and sometimes you get rashes or burns, especially if you sweat or you're in there for a long time.
Man tried to steal someone's chain and got pepper sprayed.
Damn, Debo got! You know how I know that dude's been pepper sprayed before? Because he's pouring milk in his eyes, not water. And you know how I know that? Because I've been pepper sprayed before too.
Now, let's clear up the social media garbage. Number one, milk does not neutralize tear gas. That's an old myth. Don't waste your time with milk or Maalox or fancy oils. There's literally zero proof that those help. And oils can even trap the chemicals against your skin, making it worse. Now, what milk can potentially do is provide some temporary relief, specifically from pepper spray. But even then, you're honestly better off washing with saline or water with a bit of baby soap. Number two, don't scrub, don't rub, and don't go for any hot water. Heat opens up your pores. That just lets in more of the chemical. So, what actually works? Well, here's the medical advice I would give my own patients. Step one, get out of the area. Move fast, go upwind, and get to fresh air, now. Higher ground is better since tear gas sinks low. Step two, don't touch your face. The chemicals are on your skin and your clothes. Touching your eyes or mouth will only make things worse. Step three, remove contaminated clothes. Get them off ASAP. Bag them up in plastic if you can. And don't drag it all out. Every second counts. Step 4, rinse with water or saline. A lot. Blink rapidly and flush your eyes with copious water or saline. Not milk, not anything oily. Just clean, cool water. Be sure to lean your head to one side so it doesn't wash over your other eye, by the way. Step 5, blow your nose and spit. Don't swallow. Blowing your nose and spitting out saliva can help to get rid of the irritant. You don't want to swallow it. And step 6, take a shower. But again, no hot water. When you get home, shower with cool water and gentle soap. Again, the hot water, guys, it just opens up the pores and lets more chemical in. So here's the bottom line. Tear gas is especially dangerous for people with asthma, COPD, or other lung conditions. Kids, elderly folks, and anyone with a weak immune system. These are the people who can get into real trouble. If you're wheezing, can't breathe, having chest pain, or your eyes keep burning for more than 30 minutes, go to the ER and don't wait. Now, can you protect yourself with a mask? I see a lot of folks out there wearing them on the streets. Well, N95s can help a little, but tear gas can still irritate your eyes and skin. And swimming goggles, well, they're better than nothing, but there's no guarantee. And should you wear contacts? Absolutely not. Contacts can trap the chemicals and make it much worse. Now, are there any miracle washes? Not really. Water or saline is still the gold standard. Keep it simple. Trouble breathing or severe asthma attack. Persistent vision changes, severe burns, big rashes, or if you just feel off. Listen, don't tough it out if your body's telling you something's wrong. There's no shame in getting checked. Now, I know you want the facts and not fear mongering, and that's what you'll always get here with Dynamo Health. So share this with someone who needs to know. Drop your questions below if you have them. I'll answer as many as I can. And I just want to say, stay safe, LA. I'm Dr. Dynamo. I always say stay dynamic, but for this video, I want to emphasize, let us pray for peace. Later, guys.